Hello colleagues, welcome to Mr. Coco's Nesses class. So today I want to look at Asphyxia neonatorum. Some would say neonatorum asphyxia, so it's the same. Or some would say birth asphyxia. So what happens is that under NMCZ, you discover that you are asked about this condition. Now, how you asked about this condition, meaning that they would want you to write something saying under management, and they would even ask you maybe for the signs and symptoms and all that, but they're interested also in the resuscitation part. So in this case, we're going to look at how you resuscitate a baby. Now, as long as you look at asphyxia, in case you came across this question, you look at asphyxia. As long as it says asphyxia neonatal, what should come in your mind is that this is an emergence. So even before you start attempting the question, you have to underline the signs and symptoms given, and you have to know that this is an emergency. You have to resuscitate the baby. Okay, so that's the key here. So you have to mark, underline, is the baby having difficulties in breathing and all that, so you need to underline and say, okay, this is an emergency you're dealing with, so we're going to resuscitate this baby and look at some other issues. So now, as you can see, this is the respiratory tract. Okay, so under this topic, sometimes you are asked to draw the respiratory tree, but you're not going to draw the head, of course. Just underline. Maybe you're going to look at the nose or nasal cavity. You also put the pharynx there, the trachea, the larynx should be there, the bronchi, the lungs. Okay, the diaphragm should be there. So at least you have to draw something like that and label. And as you label, you can see that there is this heading here. So you need to ensure that this heading there, which is there, the heading should be present. Okay, so that's what you do. So ensure that the heading is there and you're able to label properly, so that will carry marks, and you have to just know that that's what NMCZ would want from you. Okay, so then let's look at now the definition of asphyxia. What is important about this? Okay, so if you look at the definition of asphyxia, we're going to look at to say this is respiratory failure, okay, in a newborn. So that should be number one, respiratory failure in a newborn. And then what happens in this case? So it is caused by inadequate intake of oxygen, which is here. Okay, inadequate intake of oxygen. So this is something that you can do. Okay, so respiratory failure in a newborn, okay, which is caused by inadequate intake of oxygen before, during, or just after birth. Some would say that this is failure for a baby to sustain breathing, or to initiate and sustain breathing. So you can find something that could be suitable for you. Okay, but at least you need to know that it's failure for a newborn to breathe, and it has to be maybe before, during, or after birth. Okay, it can be caused by inadequate intake of oxygen. So then if you look at now this oxygen we're looking at, since we're looking at oxygen, helps the tissues to combine with glucose and then produce energy. So that's what oxygen is there in the body. It's used for that. Then what if then oxygen is lacking in the body? What will happen? So if oxygen is lacking in the body, what will happen is that this neonate will have what we call brain damage. Okay, so the baby will have brain damage. That's why we're saying that this condition is regarded as a neonatal emergence. It's a neonatal emergence because it will cause brain damage or death if not treated. So that's what happens. So the issue here is oxygen. Okay, that's what we really look at. Then let's look at other issues. Then how do you really say, how can you diagnose this baby to say, okay, this baby is having a problem, okay, with breathing? So meaning that you're just going to say that this baby has what? Failed to establish or sustain the respirations, meaning that that's what we're going to say. Look at to say this is asphyxia because the child has failed to initiate or sustain breathing. Okay, so then let's look at other issues here in terms of the causes. So in your NMCZ paper, you discover that you are asked according to the classification. Maybe say the causes according to maternal causes or neonatal causes. Mostly these are the common ones where they say write the maternal causes of asphyxia or the neonatal causes of asphyxia. So when you look at the maternal causes of asphyxia, these are the ones that we look at. Okay, but there are so many. Okay, there are many more, but then we'll look at these as maternal causes of asphyxia. So if you look at the maternal causes of asphyxia, number one, we've got this is hypoxia. Okay, so under hypoxia, we're looking at reduced oxygen in the tissues. What can reduce the oxygen in the tissues? Meaning that the mother can have either severe anemia or a cardiac disease or a respiratory disease. These can reduce oxygen in that lady or that woman, leading to hypoxia. So meaning even the baby will not receive adequate oxygen. Okay. Number two, we'll look at reduction in uterine blood flow, meaning that the uterus is not receiving enough oxygen. And if the uterus is not receiving enough oxygen, what will happen is that the placenta also will lack oxygen. And if the placenta is lacking oxygen, meaning even the baby will lack oxygen. So this is the second cause. Other causes would be diabetes mellitus. We know what diabetes mellitus does. Diabetes mellitus, say for example in post-maturity, it will result in a reduction of blood supply to the placenta. It reduces the blood supply as well. So meaning that if the placenta is lacking enough blood, meaning it will not have adequate oxygen to supply to the baby or the neonate. So meaning that as it is born to lack oxygen and it will have asphyxia. Then antepartum hemorrhage, meaning that in this case the woman is bleeding before delivering. If it's, the woman is bleeding before delivering, meaning that what will happen is that the blood will not go to the placenta. And if blood is lacking in that placenta, what will happen is that this woman will have also reduced oxygen, so as the baby. So that leads to asphyxia. So it's all about oxygen, blood flow to the placenta, blood flow to the baby in utero. So it's all about reduced blood flow to the baby. That is it that we're talking about. So even maternal convulsions, it's the same. Maternal convulsions also reduce oxygen. So all these will reduce O2, okay? So if you look at O2, all these are reducing O2. That's what we look at. Then let's look at other issues. So these other issues would be on neonatal causes. So if you look at neonatal causes it's the same as well. We're looking at something that can reduce oxygenation in this body for this baby. Now we're looking at the baby, not the mother, but the baby. What can reduce oxygenation? So the first thing is that we look at is blockage in the airway. So if you look at blockage in the airway, meaning that the baby might have aspirated meconium. So for those who do not know what meconium is, we're looking at the stool or the feces that the baby would pass while in utero or while in the uterus. So if it passes stool in the uterus, which we're calling meconium, meaning that will be swallowed in the airway and blocking the airway, meaning that as it is born, it will be unable to allow oxygen to go through, meaning the airway will not be patterned. Others could be congenital abnormalities. That's the second point. Congenital abnormalities such as maybe of the nasal passages, meaning the baby would be born with nasal passages which are blocked. Okay, so that also blocks. Then we'll look at the third point, which is diaphragmatic hernia. Look at diaphragmatic, we're looking at the diaphragm. So there should be some herniation there, which can also result into the trachea maybe being obstructed. So that also leads to a reduction in the oxygen intake for this baby. The fourth point is septicemia. So when we look at septicemia, we go back to microbiology. When we look at sepsis, we're looking at infection. Then emia, we're looking at infection in blood. So emia is blood, or septicemia or sepsis, we're looking at infection of the blood. So if there's an infection in the blood, what we're looking at is that in this case, infection or microorganisms in the blood would destroy the red blood cells, which will result in a reduction of blood, or we call it anemia. So when there's anemia, what will happen is that there will be a reduction in the oxygen carrying capacity. This child will go in asphyxia. Then other issues will be inadequate surfactant. So for those who may not know what surfactant is a chemical which is produced in this infant's lungs. So when the lungs produce this surfactant, they help the lungs to expand properly so that oxygen can pass, or there should be exchange of gases. But then if there is no surfactant, there will be a reduction in the exchange of gases, leading to accumulation of carbon dioxide in the body, leading to maybe say hypoxemia or hypoxia. The child will go into what we call asphyxia. Okay. Then let's look at another issue, which we're calling placental causes. So these are just issues to do with the placenta. When we look at infants, we'll look at maybe say dark patches. So these can be dark patches on the placenta. Okay. So there can just be dark patches on the placenta, meaning that we're looking at rotting. Some patches, maybe say the placenta is rotten in some patches or in some parts, meaning that there will be no oxygen or exchange of gases which will be happening on that area, or that area which has infects will not allow oxygenation to go to the baby, meaning that maybe the woman might have been smoking or might have been abusing drugs. Then previa, we're looking at the location of the placenta. It might be that the placenta is lowly maybe located maybe near the cervix. That will not allow maybe enough oxygen to be extracted from the uterus to go into the placenta to go to the baby in utero. So this also allows, this also reduces oxygen. Then let's look at the fetal causes. Fetal causes, also these, when you look at them, they're also just dealing with a reduction in oxygen. Okay, so they just deal with the reduction in oxygen. So if you look at small, for gestation, we're looking at a small baby. Maybe this small baby, the lungs are not fully developed, even the glycogen storage are not well formed, so this one will not be able to sustain breathing. Then when we look at rhesus incompatibility, we'll look at hemolysis, meaning that there is a breakdown of red blood cells, which will lead in a reduction of oxygen carrying capacity in the body. So that's what happens here. Okay. Then when we go to another category, so we'll go to umbilical cord issues. So all these, if you look at them, they also deal with a reduction in oxygen. So that's the rationale for a knot, meaning there's a knot in the umbilical cord, or the cord has been compressed, which is this one, or maybe the cord has prolapsed, meaning you can see it through the vagina. Okay, from just from the uterus, you see it through the vagina, meaning that it has dropped. Then rupture of the cord, meaning that it has bursted or something due to pressure. So these are just dealing with the reduction in oxygen. But mostly, what they ask you for you to write would be neonatal causes and maternal causes. But even these, it's just good to know them. Then those are the two that you really have to know. So during labor, these are the other causes. They're also, like I've explained, they're also dealing with just a reduction in oxygen. So it's all about a reduction in oxygen to this infant. So you look at excessive analgesia or pethidine administration, it's the same. Or malpresentation of the baby, meaning that it's not well presenting, maybe say it's not encephalic, or maybe it's just in breech, so that will happen. Or maybe cord around the neck, meaning that the baby is having more like a coil in the neck, which is strangulating the baby. Okay. Then manipulated delivery, we're looking at vacuum extraction, trying to force the baby out, so we can really reduce its it's oxygenation. Then prolonged labor, we are looking at maybe labor that has taken more than maybe say the 16 hours or 12 hours or even more than 20 hours. That's prolonged labor. Okay, then let's look at the classifications. In your paper, if you check for NMCZ, you discover that you are asked about the classification of asphyxia. Some time back, we were classifying asphyxia as say for example, so some time back we were classifying asphyxia using maybe three classifications, which were mild, moderate, and severe. But then this time, what is encouraged is that we only use two classifications, which is here, where we're looking at mild, and then which another one which is here, where we're looking at severe. So you only need to classify two, or you need to have only two classifications, which is mild and severe. So when you're asked, when you check NMCZ questions, you discover that there is a question which will ask you about the classifications of asphyxia. So the first one is a mild. So mild, you need to just write it, say mild asphyxia. So you can just add something there to say mild asphyxia. So where you should explain to say the heart rate will be in the range of 60 to 80 beats per minute. You need to explain that. Then also talk about there will be a good muscle tone. The baby might be asphyxiated, but they will have a good muscle tone because they only have a mild asphyxia. Then the infant will be responsive to stimulus or stimuli because it just has that mild, so it will just be responding and it will be active. Then it will be deeply cyanosed, meaning that it will appear blue. So it will be blue. So if you give it oxygen, or mostly you give it oxygen there, it will tend to pink. Then what will be the APGAR score? APGAR score will be maybe say 5 to 7. That is a mild. Some would say they would give it maybe a score of maybe 7 to 8. So it depends with the location and what you classify as mild. But most literature would say 5 to 7. Okay, and then maybe say 6 to 7. Some literature will be saying that. Okay, so that's about mild. So you can write those points about mild, meaning that you're good to go. Then when you go to another classification, you have to go into severe. So when you look at severe meaning that you're going to have this infant or this infant or this baby who might not attempt to breathe. So that's why I've put this point, not attempting to breathe. So this baby might not attempt to breathe. Okay, that's the thing, they're not attempting to breathe. So that's the issue, meaning that this is why we come in with resuscitation. It has to be very quick. Then poor muscle tone, they won't have good muscle tone because they're severely asphyxiated. Then when we look at the color will be pale or gray. Okay, so these will require higher concentration of oxygen than mild. Then APGAR score will be less than 5. Okay, so when you say less than 5, it may be 3, it may be 2, somewhere there, or it may be just anything but less than 5, meaning that they are severely asphyxiated. Okay, so it may be 3, it may be 4, it may be 5, or just less than, say, 3 or 4. So that's what we can have. So you can say less than 5, then you're just okay there. Okay, so when we now can proceed to other things, let's look at the pathophysiology, because some literature you may find that we skip the pathophysiology, but then NMCZ, they're very tactful sometimes when they bring questions. They might give you this. So let's look at what they might give you. We're looking at something that people don't like. I know people don't like pathophysiology, especially students, but then NMCZ might bring this and it may carry a 15 marks. So that 15 marks, at least try to bring in something that might help you pass the exam. So let's look at now what happens. So since we're dealing with oxygenation and the issue of carbon dioxide, so let's say in asphyxia, that's the first thing that we're doing here. Okay, we're looking at a depletion. So what depletes or what goes down? So if you're looking at what will deplete or what will go down, what will go down is what? Oxygen. That's the thing. So in asphyxia, I'm going to explain to say what to deplete or what to reduce in the bloodstream, what to deplete in this baby's body will be oxygen. So if oxygen goes down, what will go up? Then it will be carbon dioxide in the body. So that's the exchange which is happening. In asphyxia, the depletion is oxygen, or it goes down. Then what goes up is carbon dioxide in the blood of this baby. So now what happens if, say, oxygen reduces, carbon dioxide goes up? What will happen is that there will be what we call, this point is the same or it's similar. So when carbon dioxide goes up, what will happen is that it will promote what we call metabolic acidosis or respiratory acidosis. But this metabolic acidosis, it's coming in because there is this glucose here, which is also depleted. Okay, so this is in combination. Then when we look at carbon dioxide increase, meaning that this will cause respiratory acidosis because it's carbon dioxide, we're dealing with respiration. Then this depletion of glucose as well, because of this raised carbon dioxide, it will cause metabolic acidosis. Okay, so that's what happens. So some even go to say what will happen now to this acidosis. There will be this bicarbonate which the body will try to produce so that this acidosis what goes down. But then since there is no oxygen coming in, will this bicarbonate reduce this acidosis completely? The answer is no. So what will happen is that this acidosis, which we're looking at here, will now go further and cause what we call a depressed cerebral function. Okay, depressed cerebral function, meaning that it will reduce the function of the brain. When the function of the brain reduces, it will cause what we call brain damage, which is here. So when a brain damage occurs, what happens now to this baby? Okay, so what happens is that this brain, which is here, okay, the brain tissue is not receiving enough oxygen. Then the heart also is not receiving enough oxygen, okay, and the other tissues. So they'll go into what we call hypoxia, meaning that these tissues are not receiving oxygen. So they go into hypoxia. Then what happens if a baby goes now into hypoxia? The heart rate will increase, maybe trying to compensate. But will this also help? The answer is no. As long as the airway is blocked and you haven't done the resuscitation, the heart rate will increase, but nothing will happen. Okay, then the baby eventually will become what we call cyanosed, meaning that it will become blue. Okay, when the baby becomes blue, it will become apneic, meaning it will have those pauses whereby it will be pausing as it will breathe, then it will have a pause. Breathe, will have a pause. That's what we call apnea. Okay, which is also referred to as asphyxia livida. Okay, that's what occurs in this neonate. Okay, so then let's look at now what goes on further. So as this occurs, there is an increase in hypoxia, meaning that this baby now, the body cannot sustain itself anymore. So what will happen is that there will be a bradycardia. Okay, so don't mind about the superven, just say there will be a bradycardia. Okay, which is also now cause this phase is called asphyxia pallida. So there is asphyxia lavida, meaning that the baby becomes cyanosed and apneic. Then when it becomes bradycardic, meaning that the heart rate reduces, meaning it will go into asphyxia pallida. Okay, so unless quick action is taken, meaning that now this will worsen, the bradycardia will worsen, the tissue damage will worsen, so even this hypoxia will worsen, everything will worsen, then eventually death will follow. Okay, so this is the end result, death. So the issue, if you have noticed here, is just as hypoxia. So we've just dealt with oxygen, we've dealt with carbon dioxide, just that, those two things. Carbon dioxide rises, oxygen reduces. If as long as we don't resuscitate, carbon dioxide will keep rising. So this is what will lead to death. Okay, let's look at now the signs. Now, what about the signs? So if you look at the signs and symptoms of asphyxia, we'll look at them, say, in utero, at birth, but then this does not matter. What matters is as long as you know how to write about these. So you can write anyhow unless they've specified, but they don't usually specify. They just say write the signs and symptoms of asphyxia. So according to the pathophysiology, if you followed very well, what we had was we had a heart rate. Okay, this heart rate. Now remember that we had at some point we had the tachycardia, then we had the bradycardia. So meaning that there was this reduction in the heart rate. That's why we're talking about a bradycardia. So this is how come we are saying that a heart rate less than 120 beats. So in those maybe a fetus or a newborn baby, a heart rate of less than 120 is not okay. Even a heart rate of less than 100, say maybe you get heart rate of 90 beats per minute, meaning you need to resuscitate, or maybe 60 beats per minute. It's not good for this infant. Okay, so that heart rate. Now in utero, you may discover that if you are doing maybe a Doppler, you discover that it's less than 120 or maybe less than 100, meaning this is not good. Okay, then there's some technology which is there. Some people are able to get this metabolic acidosis. Maybe they're able to measure the pH. They find that the pH may be normal, or maybe if they discover that they metabolic acidosis, meaning that this is a sign. Okay, then when you do, maybe the membranes have ruptured, you discover that there is a meconium in stool, or sorry, in liquor, or maybe say amniotic fluid. That's what we call liquor or liquor. Some say liquor, but liquor. Okay, so if you discover there is a meconium or feces or stool, you discover that, meaning that the child is asphyxiated because the sphincters become loose because of hypoxia. So that's why there is passage of meconium. Then when you discover excessive movement of the fetus, just know that the fetus may be going into distress or it's lacking oxygen. That's what we have there. Okay, so then let's look at other issues, say at birth. At birth, you may discover that this neonate has an obstructed airway. So that's why people need to know how to suction. Discover that there's meconium. This airway is blocked by meconium. So if it's blocked by meconium, meaning that you need to suction. So if you discover this, meaning that that's a sign that this child is asphyxiated. Then you discover that there's either primary or secondary apnea, meaning that it's there's temporal cessation of breath. Like I said, breathing, stopping, meaning that this child is asphyxiated. Now, when you discover that there is a low heart rate, meaning that this is bradycardia. Okay, so when you discover bradycardia, meaning that this child or this infant is having asphyxia. Then poor muscle tone, like we agreed on the when we're looking at classifications. When severely asphyxiated, to have a poor muscle tone. So you discover that this infant has a poor muscle tone due to reduction in oxygen flow or lactic acidosis. So that's a sign. Another sign will be here, cyanosis, which we discussed in the pathophysiology. These neonates become cyanosed, so that's what we have. Then any other will be a weak or maybe weak reflexes. Like we said, the child who is severely asphyxiated will not have those reflexes prominent. It will be flat. Okay, so that's what we have there. So this is due to hypoxia or acidosis. So this has to be followed in the pathophysiology. So in terms of management, this is what we really need to be careful with, because there's some questions which say resuscitation, they give it 20 marks or 30 marks. So it's now up to you to be tactful in terms of writing. So if you want to write maybe something small, looking at the marks, maybe say 15 marks, you can go with the ABC. Okay, you can go with the ABC format, meaning that under the ABC format, during your resuscitation, meaning that the points will be few. But then if you discover that they've put on the plate 30 marks for resuscitation, meaning that you have to write it like that, like the way it is in my notes, meaning that that's what you're going to do. So you need to go into the steps. So skip those, but let's look at this. So meaning you need to first of all deal with the drying and keep the baby warm. So you need to write that, or you need to explain how to dry the baby and stimulate the baby and keep it warm to prevent what? Hypothermia. So try to add those rationales. So you're keeping it warm, you're drying it to prevent hypothermia. Then 2, you start the clock. Why starting the clock? This is because you want to time or to see how long you're going to perform your resuscitation. Then after drying and all that, you need to assess the baby for the following: the color, the tone, the breathing, the heart rate. Meaning, why you're doing this, you need to see whether the drying has stimulated the baby enough or brought the baby to normal, okay, or the heart rate has gone back to normal. So that's what you need to look at. Then if the baby is crying and breathing well, provide routine care. Keep maintain warmth, maintain warmth, keep the airway clear, okay, provide routine care. If the baby was to cry, then what about if the baby hasn't cried? What do you do? Meaning that you need to now conduct ongoing, this is what to say, ongoing evaluation, meaning that you need to assess the baby again, okay? And then if the baby is gossiping or not breathing, do the following. Now you need to position the baby in what we call neutral position. So this neutral position, you don't need to put a pillow. It has to be just a little bit slanty on your side, on your resuscitator, but not really very slanty like I'm doing it, but at least something, yeah, not slanty, that's, but at least has to a little bit, not really with a pillow, just a little bit, your head facing you, the head of the baby facing you, so that at least you can be able to suction the baby or see the breathing. Then next thing, after position the baby in a neutral position so that you resuscitate. That's the rationale. You need to position the baby in a neutral position so that you resuscitate. Then what follows is that you need to open up the airway. When you open up the airway, what you're going to do is you're going to have now direct visualization. You're going to see inside and do the suctioning. That's why I was saying suck. Okay? Suck under direct visualization, meaning you're going to open up the airway and suction. Then after suctioning, you can assess, but again, you need to be fast. I mean, you're not going to, instead of going to assessment, first of all, give what you call 5 inflation breaths. Okay, the 5 inflation breaths. So give the 5 inflation breaths, okay, 2 to 3 seconds with room air, just with an ambu bag. That's what you use here, so that you provide. The rationale is that why you're giving 5 inflation breaths is that you want to provide enough oxygen. Okay, you need to provide enough oxygen to the circulation. That's why you need to give the 5 inflation breaths. Then what you need to do now, you need to go to the assessment where you check the chest for movement, and also need to check if the baby is breathing. Just confirm. Okay, if the chest is not moving, do the following. Now you need to do the following, meaning that you need to now again, if there are secretions, you need to suction them. Okay, you need to suction. If there are secretions, you need to continue. Then recheck the head position, because you need to promote a patent airway. Why you need to position that in such a manner is that you need also to provide a patent airway. Then you can also provide an oral pharyngeal airway. This allows for to promote a patent airway, and also to create just that airway to be open. It opens up the airway, not really to be blocked. Okay, so that's why you need to insert this. Then consider 2 persons airway control, jaw thrust, but mostly this, it's in extremes. Okay, so you can just maybe insert oropharyngeal airway, and then go to this. You need to reassess. After reassessment of a color, tone, breathing, and heart rate, if heart rate is still down, okay, what should you do? Then you're going to provide what we call 15 Okay, 15 breaths in 30 seconds. So these have to be very fast or brisk, very fast, so that you provide, enough oxygen into the baby's circulation. So that's what you need to do. Okay, then what do you have to do again if that fails? Okay, meaning that you need to, after providing that oxygen, you need now to also go into the reassessment because you've provided oxygen. Okay, so what reassessment? The same reassessment, which is a color, tone, breathing, and heart rate. If there is improvement now in that, if there is improvement, what you need to do now, since there is improvement, you need to monitor just for oxygenation, for pulse, and then after that you classify the baby and then refer for further management. Now, if, say for example, the baby responded and you did maybe the CPR. If you did CPR, you can also now take to ICU. So this is the next point which we look at, CPR. So you can look at CPR, which is here. When we talk about chest compressions, we're looking at CPR. So you can also provide CPR, which is 1 to 3. So you can do 3 compressions, 1, which is 3 compressions to 1 ventilation. That's what you do, okay, with supplemental oxygen. So if this, you're able to do this, then after this you can take to ICU. That's after you've done the CPR. So other things that you can provide is IV access, meaning that you can cannulate the baby so that you provide fluids, or you can just say IV access can also be for drugs, because you're supposed to give drugs here. So we'll look at the drugs below that you should be able to give. Okay, then you can also now check for you can do a random blood sugar, which is RBS. So when you do RBS, you are checking for at least the blood glucose levels. So you need to ensure that the baby is having at least normal range in terms of blood glucose. Okay, so then if not, maybe if it's reduced, then you are able to provide 10% dextrose at 3 to 5 mils per kg. So provide dextrose if the RBS is reduced. Say for example, find RBS of 3, 4, you can provide dextrose, or even to some will have even a 2 millimoles per liter. Okay, then that's what you're going to be doing. Okay, so other things that you're going to provide now. So this is for a 30 marks, like I said, not really for just a 15 marks. For a 15 marks, write the ABC, but you can extract the points from here. You can do airway, breathing, and circulation, getting things from here. Okay, so this is for a 30 marks if you find a question like that. So you can do that and provide the information. Then what about if, say for example, you're done with the resuscitation? What should follow? So when you're dealing with management of an emergency, you are done with the ABC or the resuscitation. What follows now? You should look at the subsequent care. Do not forget to write the subsequent. So after the resuscitation, which is a BC, now go into the eprophenema. Obviously, for those who are dealing with medicine or even pediatrics, you know that eprophenema is just the same thing, meaning the routine care that we give. So I think we'll look at this later, so that you know the routine care that you give to just any patient, meaning that you have done the resuscitation. Now this is just routine that you're able to provide. Okay, so these are just the drugs that we have and the equipment. So like naloxone, what is naloxone used for? So you find this in one word answer. They ask you about naloxone. So it's used in respiratory distress. Okay, then another common one is sodium bicarbonate. Why do we use sodium bicarbonate? The indication is respiratory acidosis, like in this case of asphyxia. Then dextrose, 50%, we are using it in hypoglycemia. Then vitamin K, we are using it because of hemorrhage, because children or babies with asphyxia tend to bleed in the brain, so you're able to give them vitamin K. Then what about dexamethasone? You're able to give them because of the risk of cerebral edema. That's what you do. Okay, then calcium gluconate to strengthen the heart muscles. That's what you do. Then adrenaline, why do you give it? To stimulate circulation. So these are some of the drugs that you discover that we have and asphyxia. What about the complications? So asphyxia has got complications, so many, but let's look at just a few. So convulsions. So this neonate can have convulsions, but convulsions won't see them as much. They are called subtle or subtle convulsions, meaning that they're very minimal. For you have to see them, you have to be paying attention. So subtle or subtle convulsions, this is due to prolonged cerebral hypoxia. That's what you're going to have. Then there's also what we call deafness. Deafness, this is due to damage to the auditory nerve. So this is a nerve that is responsible for hearing, so the child will become deaf. Then the child can become blind in future because of damage to the optic nerve. The optic nerve is responsible for sight. Okay, all this is as a result of hypoxia. Then the child to be born can have mental retardation. So this is due to cerebral hypoxia. I'm sure you've seen children with mental retardation. So that is what we have. Then the child can have brain damage due to cerebral ischemia. So you can have a lot of them. Okay. So there are those with maybe cerebral palsy. Cerebral palsy can also be one of the complications of asphyxia because of lack of oxygen. So just to wrap it up, this is what we have, and then you can also have a strategy of how you're going to write it, especially on the part of resuscitation. You need to know what you're going to write and how you're going to resuscitate. So this has been Mr. Coco. Thank you very much for listening, and study hard so that at least you can be able to pass those exams. They're very simple as long as you're studying and strategizing on how you're going to be answering. Thank you, and subscribe. And then those who are maybe subscribers, you can just like the video so that others can also be able to at least have the information, or share it to your friends. Thank you very much and have a pleasant day.